This video is talking about sort of my philosophy of how I do hair and how it's different from the big chains out there. I've hired people from the big chains, and I've had people that have left me for the big chains in terms of staffing over the years. And I have seen an insight to understand how they work and what happens, because it's almost a first-hand experience from that regard. So I'm not going to mention any names of chains by name, but I'm going to give you a philosophical difference. So first of all, just to walk you through the whole treatment, first of all, the most important for me to start is the consultation. The question with the consultation is, who are you meeting with? You're going to be meeting with either one of two types of individuals, a salesman or a doctor. There really isn't a lot between the two. Now, you could have someone who is a paramedical person, such as a nurse or an RN or someone else that's there. But the main dividing difference between chains and what I would call boutique centers like my own is the differences of, are you going to meet with a salesman or are you going to meet with me? And so the problem is, if you meet with the wrong person, that is going to be an issue, because I have a whole day where I can turn every single patient away for surgery because it's the wrong thing for them. Whereas when you go to a chain, you're meeting with a salesman who are sold on the margin. First, they don't even understand who's safe, and second of all, they don't care who's safe. I've had a lot of patients come to me and tell me, man, this is a different consultation. I'm actually getting educated about the pros, cons, limitations, and you're only offering me what's safe for me. Whereas before, it's like, you have money? In fact, one of my staff used to work at a chain, said the first question they asked is, how much money do you have? And what's interesting is not the money that I'm worried about, because yes, of course, if you do not have the finances, you can afford a transplant, that's one thing. It's how much money do you have in the donor bank. So actually, when I walk in the room, the first thing I look at is your donor bank. Even before I begin to have a consultation with you, I look at what do I have to work with, because it guides me in the whole thing. So I look at your age, medical therapy, everything. It gives me a framework. And then, of course, I start by just listening to you, asking, what are you experiencing? But if I look, for example, in your scalp and I see a scarring hair loss, well, it's going to completely frame how I have the conversation with you, because you can't have a transplant. A great example is, I saw an African-American gentleman just a couple weeks ago who went to a chain, and he was wondering why none of his grafts grew. And I looked, and the first thing I saw in a nanosecond was he had central centrifugal cicatricial alopecia, CCCA. Well, a salesman wouldn't know that, and apparently the doctor that transplanted him didn't know that, because they hired someone like a hired gun to do it, or maybe the doctor wasn't even in the room when they did it. But at every level, that was a failure, because this was something that in 1 second I looked at it and I said, oh, you have CCCA. Of course the grafts won't survive, because you don't have, your grafts won't work. Now, if a doctor was involved at any phase of that actually knew what they were doing, he would never have had a surgery. So now, not only did he waste his money, but now he's got scarring in the back of his head, whether it's FUE or strip, it doesn't matter, that's not scarless, and he doesn't have the option to shave his head. And an African American, that's an easy option. If you said, look, hey, don't like my balding, let's shave it. Now he's got a scar on the back of his head that he cannot exit on, and he's got scars from the area that he transplanted with no grafts growing. A patient this week, I just did her upper blepharoplasty procedure, and I saw that she had some bad microblading, and I said, or old tattoo, and I said, you would be a great eyebrow transplant. She says, oh my God, I went to a chain, and it was a horrible experience. I looked black and blue for weeks, and not a single graft grew. And that most likely is not a scarring hair loss from what I see. It just looks, because she had overplucking when she was young, she has an issue with the problem of just a bad result and a bad experience. And that is very common, because a lot of these places, they don't specialize in difficult things to do like eyebrows. They just have a cookie cutter recipe for you. And so the consultation is not a sales pitch. Of course, I'm in business of doing business. But I will tell you, if I can save one of you out there listening to this video from going to a chain and doing something that is not right for you, then this video is worth every second of my life here. I did a personality test, and one of the big things that I found about me is social justice. This is why all my hair transplant textbooks, they all go to charity to stop human trafficking. I'm a big fan of an organization here called the Dallas Children's Advocacy Center. I was the chair last year. I just spent 3 months doing a painting that's going to charity. And they're here to help stop child abuse and help these poor kids that have had issues. So a big thing for me about hair is if you do the wrong thing on a patient, you can't exit on it. And that's the thing. If I do a facelift on a 30-year-old that has a little bit of sagging, there are really no long-term consequences if it's done well. Of course, if it's done badly, that's another story. You do a good facelift, it's fine. You do a hair transplant on someone that should never had one, you force them never to be able to shave their head if that was an option. You waste their money, which is another problem. You have issues where that area in the next 10 years could look abnormal, and you really have almost no exit on except more surgery. So now what they thought was going to be a $10,000 or $20,000 surgery turns into an $80,000 surgery to try to fix it, and they don't have even enough grafts to fix it. So the problem with hair compared to the face is that there is no exit on hair except for more hair, and that exit you may run out of an ability to fix it. And this is why I may not turn away a facelift patient, even if they're 36 and I can get really good results on their neck, but I will turn away a hair patient when I feel that patient's unsafe. And when you have someone who's in a sales position who's all about the margin, and you will feel it during a consultation, you will know when it's not the right relationship. It's like dating someone. If you go there and you go, wow, this guy just wants a high-pressure salesman into a surgery, that's a problem. Another person that this is dovetailing over to and first of all, they shouldn't even be diagnosing anything. They're telling, I had another person that showed me the quote, 4,500 graft quote. I'm like, you got to be kidding me. He has diffuse unpatterned alopecia. He can't even have a surgery. Those grafts won't survive more than a year. They'll be gone. Then he'll be left with problems. But he was quoted some ridiculous number because that's what is printed out, is generically printed. These grafts don't mean a darn thing. One of my other staff members who used to work with a different major chain, said the way that they got their graft numbers is that they just dissected all of their 3 hair grafts into 1 hair graft. Well, the survival is going to be garbage. The see-through is going to be terrible. It's absolutely ludicrous. Anyone in the world of hair hearing that would just vomit in their mouth. I preserve all of them. I want the strongest grafts in the right areas. I want 3 or 4 hair grafts in the central forelock. I do not want those grafts split. This is why I don't charge per graft. I think graft counts are ludicrous when people start trying to think about numbers, because and that same person that used to work at this chain also worked at another doctor's office that wasn't a chain, and that person touted 6,000 hairs, 6,000 grafts because he just dissected all of them in individual 1 hair grafts. That is horrible. The graft survival is terrible. The see-through is terrible. Are you paying for a result? Are you paying for some arbitrary number that has no bearing in your mind? You don't even know what it means. These numbers are very, very sad in my mind when people are focused on just these arbitrary understanding of numbers. And as you know, the armpit of the world is Turkey right now, where people are just doing absolutely nonsense, garbage work for patients and screwing them for life. And a lot of these results are not going to be there. You're not going to even know they're going to be a problem in a while. So the first part of the problem is that the doctor is not making a diagnosis. They're not drawing the hairline for you that is safe. I have a video called Non-Negotiable Hairlines. I encourage you to watch that one, where I talk about this. But it's important that a doctor, a surgeon who has years of experience that understands why you should not have surgery, it's much more important not to do surgery on the right patient. I don't care if you don't do the surgery, it's great, but with me or anyone else. But if you do the surgery, you better be a safe candidate. First of all, before we even talk about a safe surgery, we're talking about a safe candidate. And so if you're emailing over to Turkey or somewhere just saying, hey, am I a safe candidate? It doesn't matter. Try it out. You're going to get yes. They don't have to even see your photo. You're a safe candidate because do you have money? Yes. That means you're a safe candidate. That is not what makes a safe candidate. I don't care how much money you are in the world. If you have $1 billion, I don't care if you will not be able to pay enough to fix your donor bank. Your donor bank is a finite, non-renewable resource. So listen to my donor preservation video. So if you think, hey, you know what, I've got tons of money in the bank, I got 80,000, I can fix this problem, I can fix the next 10. Yeah, great, but you don't have more in the bank. Your bank is finite. An FUE drains the bank much faster than a strip does. So I do both procedures, and I very carefully pick an FUE, very carefully pick a strip, depending on which one is better for you. Like FUE for women, I think is just absolutely crazy. So, and that is a whole nother video that I can shoot as well. But I want you to understand why it is important to meet with a doctor, not a salesman, because a salesman is going to not know how to diagnose you, how to treat you, and how to tell you no. I say no every day, all day long. I'll say no if it's not a right candidate. And as I told you, I can spend an entire day and say no. I'll tell you a whole day, I see 9 candidates, 9 consults, and I will say no to all of them. And that has happened before, many times. Now, it's not great for my business, to be honest with you, but it's the right thing for the patient. And that's why, and I would tell you, not even chains, not all, even my colleagues whom I think I respect until I see their patients come through, then I'm like, you gotta be kidding me, you operate on this guy. So this is the problem, but the chains, oftentimes you're not meeting with the doctor. Here's the next problem. Who's doing your surgery? Is a physician doing it? Or do they just hire random techs that are going there with no high school degree, that have no knowledge of medical therapy, no knowledge of surgery? They just want to sell you a surgery. And another story I saw, I had a gentleman that, first of all, is 22 years old, which is ridiculously young for a surgery. Vast majority should absolutely not have surgery, 99.9% should not. And he had, the funny thing, I've told the story in another video, the person, the tech, obviously it wasn't a surgeon, it was just someone randomly assigned to do the procedure, looked back there and said, oh, looks like you've had an FUE. The patient says, no, I've never had an FUE. He says, no, you've had one. I look back here, you know what the person was looking at? They're looking at an over-harvested, depleted zone that they thought it was over-harvested, depleted, because that's how they leave their donor areas. They wipe out and destroy that donor hair, and they're so used to seeing destroyed donor that they said, this guy's got to have destroyed donor. Now, what did he have? He had DUPA, diffuse unpatterned alopecia, which means these grafts are miniaturized. They're going to fail within 5 to 10 years, and all those grafts that may have survived if they had decent work will be gone in 5 to 10 years, and he'll be left with scars. So it was not over depleted. He did not have a surgery. What that patient was saying is absolutely the truth. He did not have surgery. What he had was a unusable donor hair that tech, who was not a physician, not a surgeon, not understanding how to do this, interpreted as, oh, by the way, you've had an over depleted donor hair, which is I'm used to, because that's what I cause all the day long, because I'm not a surgeon, I don't know what I'm doing. But they don't even know what they're looking at. They don't understand that patient should never have had surgery. So this is the key with this, is that no matter how rich you are or how poor you are, the one thing that's most important thing is your donor bank. Your donor bank is it. It is everything you've got. It is a finite, non-renewable resource that is constantly declining. Declining because of surgeries being taken, and also because if your crown expands, it goes into that zone. And you're going to have problems in the future when that encroaches on your donor hair, because you're going to constantly losing supply, constantly increasing demand of the hair loss is being progressive. So unlike if you put $10 in your saving account and you have it grow over 20 years, you have compounded interest, that is wonderful. You do not have compounded interest on the back of your head. You have exactly the opposite. Picture you have $10,000 in your bank, okay, at 20 years of age. And every year I take out $500 from it or $1,000 from it. That's exactly what the analogy would be when it comes to hair, because you do not have unlimited donor hair and it's constantly dwindling. So you have to have a predictive capacity for future problems. And so these are the problems for major chain results, is that, yeah, they spend $30 million on marketing. Sure, you're excited by the billboards, you're excited by celebrities. That's another story. I don't take celebrities. Okay, you say, well, are you going to refuse a celebrity? I refused a celebrity who said, look, if you give me a free hair transplant, you'll be able to use my image. Well, all my before and afters, all my testimonials, my website, I have 7,000 before and afters, are all unpaid. Why should I pay you? Because it's sexy. Well, that's great, but that doesn't work for me. I had 2 Dallas Cowboys. I rejected both of them, one of whom I rejected on his TV show, and he's now being a poster boy for some other company. And I will tell you that this is the problem, is the other person, the Dallas Cowboy that I rejected, his agent kept on calling me, said, look, hey, you got to do it for him. look, the agent is being paid to market for this guy so that he can secure a deal for him to come and get a transplant. I eventually did the transplant. I only did the transplant to repair the previous transplant by someone else. And I was very sparing on the donor harvest so that I didn't screw him, because I wasn't actually going to do his transplant. I only needed to fix the previous transplant. So it is important that you understand when to say no. You have to understand, who are you meeting with? Who's doing your work? Are you being sold some slick brochure with a slick TV ad or a slick billboard and that's what you're buying? Or are you buying quality?